It's great to see. It's great to see so many familiar faces here this evening. For those of you who don't know me, I'm Ciaran O'Boyle, and I'm the director for the RCSI Centre for Positive Psychology and Health. I see a lot of faces that I think I've seen online on various lectures and so on. So you're very welcome. Thank you very much for coming along this evening to help us to celebrate the launch of our first group book from the Centre, which is Positive Health, 100 research-based positive psychology and lifestyle medicine tools to enhance your well-being. And it was, I think, for all of us, and you'll meet all of the authors in just a moment, for all of us it was a labour of love. Because I think we are all passionate about the importance of this area of science, of medicine, of healthcare. That's one reason it was important for us. But the second reason that it was important for us, because we come from an institution which has a very long tradition in science and in having a research base and having research evidence for any advice or anything that we write. And that's why we very deliberately in the title and throughout this text talk about research-based interventions. It's a tricky thing to take an organization like this into this wellness kind of space. There's a lot of minds out there, but for us as an institution, we think it is important that people are helped or empowered to look after their own health. We think preventative health is becoming increasingly important, but we think it's absolutely crucial that be based on a scientific foundation. And it's for that reason that we established the Centre. And straight off the bat here, I want to give great credit to our CEO, Cathal Kelly, whom you'll hear from in a moment, whose vision it was to establish the Centre for Positive Psychology and Health, and who's also led the development of lifestyle medicine and undergraduate curriculum and elsewhere. This isn't the only centre, the only part of the RCSI in which we're moving in this direction. Our Department of Psychology has been pioneering lifestyle medicine education for our undergraduate students. So we're at the cusp of an important development, I think, in medicine and in healthcare. So having kind of worked with Cathal in the early stages is to think through the vision and to work out what it is that we wanted to do. It gives me really great pleasure to invite my boss, actually, and my good friend Cathal to address you. Cathal.
Thank you very much, Ciaran, and thank you for your generous comments. I made myself a promise years ago never to follow Ciaran O'Boyle on stage, and it'll soon become apparent why. I'm really delighted to be here to welcome you all to this really special moment. In a way, for many of you, it's the first public gathering together of those of you who've been involved in the Centre for Positive Psychology and Health, and the launch of this book, some of the many publications that have come from the Centre. And I would like to start by sincerely congratulating Jolanta, Burke, Padraic, Dunne, Trudy, Meehan, Ciaran himself, and Professor Christian von Nieuwerburgh for this book. I think it's a really valuable addition, and I think many of us and our friends and associates will get great value from it. As Ciaran said, establishing a Centre for Positive Psychology and Health has been a long-held dream for he and I, and we've had several false starts, but we eventually got there in 2020, and we were delighted that Professor Martin Seligman from the University of Pennsylvania, in many ways the father of positive psychology, agreed to launch the Centre for us. And it's not often that plans exceed all expectations, but I can say with great credit, particularly to the leadership of Ciaran and indeed his incredibly committed professional team, the Centre has exceeded all expectations. At RCSI, our mission is really simple. It's to educate, nurture and discover for the benefit of human health. And in the case of the Centre, it's through the guise or through the media, if you like, of positive psychology and lifestyle medicine. The focus of the Centre is around education, research and community engagement. And I'm particularly delighted to welcome, perhaps for the first time together physically at a formal event in RCSI, many of our foundation scholars, those the first cohort of 80 or so who completed the diploma in positive psychology, positive health. There are currently 65 other colleagues registered in that program, and I hope enjoying it. And I'm glad that you're getting the chance to finally meet each other in person. We've launched a new Masters in Positive Health Coaching, and Ciaran and colleagues are about to launch a professional doctorate in positive health in January 2023. I'm delighted to welcome colleagues from the HSE, from the Department of Health, from the health services who are valuable collaborators in this, and also from our core faculty in RCSI, our Deputy Dean for Positive Education, Professor Anne Hickey and colleagues, who are stitching the elements of positive psychology and lifestyle medicine into our educational programs, building a continuum from undergraduate education to postgraduate training to CPD for specialists in practice. In terms of the research is focused on 5 key areas: resilience development in students, which I alluded to, burnout prevention and well-being, particularly in healthcare professionals, positive interventions in patients with chronic diseases, and community approaches to health and wellness, and integration of positive psychology and lifestyle medicine. The centre recently completed an MOU with the HSE, which we're really delighted to work with colleagues in the HSE and leading out on Healthy Ireland campaigns. And more recently, Ciaran and colleagues concluded an MOU for the University of Melbourne's Centre for Wellbeing Science, one of the world's leading centres in well-being, hoping and in planning indeed to launch a global classroom of joint teaching programs between colleagues in Melbourne and colleagues here in Dublin. But I think it's in community engagement that the centre has exceeded all expectations. And cometh the centre, cometh the time, if you like. While the centre was planned long before the COVID pandemic, it really hit the ground running and provided, I think, a really important service at that time. 39,000 people among the Irish general public signed up for the online programme in the science of health and happiness. It's estimated that the output of the centre has reached about 150,000 young people in Ireland. And the impact of that, when one considers the mental health crisis among young people, is really, really impressive to reflect upon. They've had 3,000 participants in the science of health and happiness as we age. And the output has been phenomenal. 2 books, 5 journal articles, 12 publications currently in press, 60 articles published in the global and Irish publications, about 80 public engagements. And I think of importance, RCSI contributes to an online journal called The Conversation, which is a form of deep journalism and an online not-for-profit publication. And so far, the output for the Centre for Positive Psychology and Health at RCSI has had over 1 million reads. So I think we get a sense of the potential and the impact of this centre in its short 2 years of existence and its potential for the future, which makes me particularly delighted to be here today and to celebrate the work of Ciaran and his colleagues. And I'm also particularly delighted to welcome our graduates from the centre and our current students. So without further ado, I'll hand over to our Master of Ceremonies, Ciaran O'Boyle.
Thanks very much, Cathal. So can I invite our authors onto the stage, and also our interviewer, MC, Shana, whom I'll introduce just in a moment. Would you like to come up and take your seats, please, and I'll introduce you. Yeah. So again, many of you will know the authors on the stage. Starting from, this is our brilliant team. Starting from my left here is Dr. Padraic Dunne, who is both a very unusual combination, both a psychotherapist but also an immunologist, who has kept us very much on track in terms of the biological and physiological substrates of what we're doing. Beside Padraic is Professor Christian van Nieuwerburgh, and anybody practically in the world who knows anything about coaching will know Christian's name. from his many books and publications, particularly in relation to the role of positive psychology in coaching. Beside Christian is Dr. Trudy Meehan, who is both a senior clinical psychologist and a research psychologist, and again brings this wonderful combination of clinical experience and research experience to bear. And then last but certainly by no means least is Dr. Jolanta Burke, who for anybody in positive psychology practically internationally needs no introduction. Jolanta is one of the thought leaders internationally in positive psychology, and has had a remarkable output and a remarkable impact on positive psychology, and not just on positive psychology, but also on positive education. So these are the people who basically wrote the book. I wrote about a sentence at the start, but I'm old enough now that they allowed me to have my name stuck on with them. And then I'm really delighted to introduce our quiz person. Is that what we would call you, Shana? Shana Keane, who is very well known in Ireland. She's based in Ireland, and she's a psychologist with over 25 years experience working in consulting, in broadcast media, and in the tech industry. She's a learning and development faculty partner and facilitator with some of the world's largest tech and consulting organizations, specializing in diversity and inclusion. Busy time right now, I would imagine. She also specializes in helping leaders and managers adapt to their team's hybrid working, this new way of working, and in navigating their mental, emotional, and behavioral ecosystems. Shane is a PhD researcher with the Cognitive Behavior Psychology Research Lab in UCD. She's an MA in Social and Organizational Psychology and a master's degree in the Psychology of Mindfulness-based interventions in UCD. And her doctoral research, very interesting, centers on mitigating the impact of stereotyping and biases in decision-making, particularly in pressurized environments. She's very well known. She spent over 12 years as a broadcaster with RTE and previously as a global project manager with multinationals such as Accenture, Ernst & Young, and GE Capital. You're really welcome to RCSI. Thank you very much for being here.
Thank you for that. I'm the least qualified person on the panel, but I'm the longest CV. No, thank you for that. It's lovely to have everybody here. Can you hear me okay? Is the microphone working? And this is such an honor for me. I have to just give you a very brief background because I want to get into these people really, really quickly. Jolanta Burke, Dr. Jolanta Burke, I know her as Jo. I have her in my phone as Jo Positive. We met 13 years ago out of both of our love for positive psychology. We didn't know what to do with it. And so we set up a group, a sort of a test group. It was like a book club where we came together every month with a bunch of people and we looked at the latest research and we tested it out, and we were like an experimental group, but no control group, no nothing. There was no gold standard there. You wouldn't have been happy with our research. We were just trying it out for ourselves. It very quickly turned into a guru session where we sat around Jo's feet and just listened to her because the encyclopedic knowledge that was in this woman's head was extraordinary. And all of us from that group have gone on to work in different areas all around in the same zone. So I asked Jo to come talk at something a few weeks ago, so I got to read the book. She said, why don't you look at this book and we'll talk about that. I texted her every 5 minutes while I was reading it. Like, this is amazing. This is amazing. I'm so like well-being jaded from all the noise that is in the media, and I was dying for something that collected the gold standard of scientific research. Jo brought an incredible group of experts together to create this book that is the gold standard. And for people like me, or for anybody who's just interested in well-being, it is so exciting to get this in one group. So I'm going to kick off with you, Jo, as the person who just started the project and brought this wonderful group together. What was the reason for the book? What makes it unique? What was your raison d'etre?
Well, first of all, thank you for this amazing presentation of me. It's been wonderful working with Shayna and everybody else about 13 years ago or so, learning about positive psychology and what it adds to people, and testing some of the interventions that were available at the time, of which there were not many. And over the years, what's happened is that there was this explosion of research and nobody was really capturing it. So I came to the centre and we chatted, and this was actually the first project we got involved in. So we've worked very much beautifully as a team. It was one of the most amazing teamwork experiences I've ever had, because we've written this book in 3 months. It was really fast because we were all exploding, trying to share knowledge with our readers. And there have been some amazing discussions, and the wonderful thing about this book is, number one, is that it's really practical. It is for healthcare staff, it is for anybody really that wishes to embrace positive psychology, be it and lifestyle medicine, because lifestyle medicine is a huge aspect of it. And this is another great thing that has happened. We've married positive psychology interventions with lifestyle interventions, because often positive psychology looks at people as floating heads. We don't consider the rest of the body, whereas lifestyle medicine considers the whole person. So we've really created this compendium of very practical activities that can help people live a good life.
So what we'll try to do is bring you on a little overview of the book, and let's get some snapshots from it. The general way the book is laid out is in from the wheel of health and well-being, so all these different sections, and the tools are within each of these sections.
That's right.
So can you just bring us through the structure very quickly, and maybe give us one example, and then we'll get more.
So it was actually Trudy's idea. We were trying to figure out how to put all of these hundreds, because we actually came up with hundreds of interventions, and we selected just 100 of them. But we tried to figure out how to present it to you best. And Trudy came up with this idea of, when you walk into a healthcare store, maybe you want to buy candles. You have energizing candles, calming candles. And we thought, this is a brilliant idea. Let people choose what type of interventions they want to select from the book. So we've put it into these calming tools, energizing tools, coping tools, feeling good tools, meaning-making tools, relationship prospecting tools, and some of the emerging tools, which are tools that we haven't had enough evidence of to put into the book, but hopefully there will be research out there soon that in our second edition we'll be able to put all this information in there.
And can you just pick one of your favourite tools? It's a great reference book for
loads of. So I love the tool that actually my colleague and I have done research on. This is to do with sleep. We try to find ways in which we could help people sleep better, improve the quality of sleep. So we've asked people to leave their phone behind for a week behind their bed when going to the bedroom. So either switch it off or just literally physically leave it behind. And many people were scared of doing it, first of all, but eventually decided to participate in this research. And then a week later, loads of fantastic things have happened. So first of all, they had much better quality of sleep. Secondly, their quality of life has improved. Their well-being has improved. They said they talked to the partners much more. They also said that, I don't know whether it's an appropriate thing to say here, but but their sex life has improved as well during this 1 week intervention. So we thought, you know what, let's ask them, would you actually continue with this activity? And they said 93% of them considered continuing with this activity. So that's one example of tools that we have in this book.
Super, it's a way to sell it to your partner as well.
Oh, definitely.
The results. So can I come on to you, Trudy? Your area of specialty is the art and mental health, and creativity is that's a really important contribution that you have for the book and for us as intelligent human beings that need to not just study every day, but actually have a creative brain.
Well, Jolanta's helped me to talk about it by talking about the connection between mind and body and the whole person. And even intelligent people were creative. It's part of intelligence to be creative. It's part of our instincts to create and move forward. So it's a very important part of who we are, but it gets named differently, I think, depending on your social class, your profession. Like, it's interesting, Jolanta gave me credit for that, but I come from a retail family who would be working class, so I would never have been considered creative, but I'd be good in a shop. But, you know, and so your talents get named differently sometimes. So I think we need to be careful around how we name things. And that's partly why I'm so passionate around creativity, because creativity, we know it's very stratified in terms of financial and class structure and who engages with it, who it's available to. So part of the challenge with creativity is making it available and accessible, and breaking the barriers down and taking the value out of it. So you don't have to be good at art to be creative. It's not about the final product. It's about engaging in it. And I think that's been really affirmed by the World Health Organization, which is really exciting for me, because they have started some collaborative centres across the world specialising in the link between art and health. And their nearest one to us is University College London. And if anybody's interested, Daisy Fancourt is a fabulous researcher. Her work is and her ability to communicate some of the research on the value of art and health. But her team there have identified 139 active ingredients in arts engagement. And within those ingredients, they've identified over 600 mechanisms through which art works within providing health and wellness and promoting health and wellness. And they're busy unpacking those and kind of we're looking at the links and how they're related to other factors. And she's developed a toolkit for people practicing in arts and wellbeing. And it's just a very exciting time because the evidence is starting to come out to really support the value of art, not just to be better at creating things, but Christopher Bailey, who's the lead for art and health in the World Health Organization, he describes the value of art and creative engagement as being deeply comforting, healing. It can help accelerate our health when we need to heal, and it helps us build communities and connections. And for lots of reasons that we're still unpacking, art is an accelerator in lots of those things. And it's very good for arts in terms of health promotion and communicating. So I think it's very important. So that's why, for me, throughout the book, people will find very accessible, not intimidating, small pieces of tools and activities that are creative with a small c. And you don't have to be Beyonce or Leonardo da Vinci to be considered creative. And I think that's really important. So I don't know if that...
Yeah, no, it's incredible. When you're talking about creativity, it's reminding me this year in the Leaving Cert, I think for the first year or for the next cohort that go through, you don't have to be good at drawing for art. It's the first time it's happened that you can do photography, you can do sculpture, you can do something, that creativity can be something other than you're good or you're not, which is why so many people stop creative endeavours.
Exactly, because creativity is more than just the technical skill. And we see that more and more now with the advent of AI-generated images. The computer can generate the image, but it's the human that brings the imagination. So when we think about creativity, we need to think about something that happens within our heads. And in a way, our minds are in search of hands and our hands are in search of a brain. And I like to think of creativity as a dance between our brains and our hands. And when they work together, it's amazing. And so I think that's important.
That's lovely. That's lovely. And so part of the tools, and I assume as you were saying, it's in all of them, is just bringing out little elements of allowing us as adults to be creative again, even though it's something possibly many of us have left behind for a long time ago.
Yeah.
I want to bring in, I feel really bad. I don't want to go along the line as though we're reading. I know a lot of you, these have been your lecturers, have they? So there's lots of positive vibes in the room unless you gave them really bad marks. But so you get to have your own back. We'll do questions and answers in a moment, and if anybody really wants to throw something at it, you're welcome. But I want to jump. I'm going to go down to the other end because we've talked about creativity just to mess it up a bit. And your work, Padraic, a lot of you would have worked with Padraic around the world of stress, around the world of burnout, especially with healthcare workers. And of course, here we are in these hallowed halls in the healthcare centre. And for you, what was important for you to put into the toolkit or into the tools that help with stress, help with burnout or coping?
Sure, thanks, Shana. Can I just say before I answer the question, can you feel the enthusiasm that comes from my colleagues here, right? And my colleagues also in the front row here. It's important for me to say, like, what a pleasure it is to actually have colleagues like this. And I was just thinking, who needs a gas and oil problem if you could power this enthusiasm, right? So I'm sure you can feel it, right? And it's a great, unfortunately, because of COVID and things like that, we didn't have the opportunity to link with students on our courses. And Christian I've only seen twice, actually, So it's great to see people in person, but that enthusiasm, it just goes to show, it can transfer across technology. You don't have to be close to somebody to feel it, So it's just important for me to be grateful for that. And as I said, my colleagues in the front row as well, it's really important. But anyway, back to lovely things like burnout and stress. And I'm sure several people in the room have been bored to death with me talking about stress over a number of different lectures. Because I have an immunology background and research science background, and I'm a psychotherapist as well, I kind of fall into that stool in the center of throwing up the biochemical pathways and things like that. So I probably get the more boring stuff sometimes, but we try and make it a little bit interesting and to bring a story to it, right? And that's what hopefully some of the people who've done the course actually feel, that we're bringing stories with the biochemistry or the physiology. And I'm getting around to answer your question now. In terms of the book, the idea is to bring stories and examples with the boring stuff. Now, we had many conversations about make this evidence-based because this is a scientific institution that must be recognized as such. But at the same time, we still want to make it a little bit interesting. So we have to bring a story into it. So for me, you've got to tell the story with the science, with the evidence base, and have your references. And if somebody wants to read the science, you dig deeper in there until the cows come home. So that's the basic kind of idea behind a lot of the ideas in the book. But in terms of stress then and burnout, so first of all, if you didn't have stress, you wouldn't get up in the morning. If you didn't have stress, I wouldn't be here in this room. I'd be running for the hills, right? If you didn't have stress, you probably wouldn't have a family. We wouldn't evolve as a species. None of us would be here. So stress gets a bad rap. We need it, but we need to get a handle on it. And we need to use it like a screwdriver in the toolkit. So when you want to use stress and ambition and drive, you pull the screwdriver out and you use it as a tool. The problem is in the modern 21st century, the stress is all-encompassing. It starts to bleed into everything. And it is as much, and I hate this phrase, and I really hate this phrase, and I don't know if it's of Irish origin, but it's all in your head. I really hate that phrase because it says such terrible things about certain individuals who are suffering from many different things over long periods of time. But at the same time, it is all in your head. So the physiological responses that are initiated within nanoseconds of negative thinking. So if I'm sitting up here and I'm thinking, everybody's looking at me and they think I'm a bit of a fool up here, immediately my nervous system is activated, which will activate my immune system, my hormone system. All of those goodies start activating immediately. Now, if I've got something wrong with me, like cardiovascular disease, if I've got a chronic immune condition, well, that just lights another little fire underneath that. So it's back to basics. It's managing, first of all, the thinking process, and then the body as well. And it's a chicken and egg, which comes first. Most of the time, I think that the thinking process comes first, but at the same time, you've got to look after the body. As Jolanta said, we're not some giant head walking around. We have this wonderful thing that we actually take for granted. We treat it like a mule. We give out to it when it has aches and pains. We don't respect it. You need to respect your body first in stress. And the first thing you need to come to in stress of any kind, and usually now, unfortunately, in terms of the clients I would have in a small psychotherapy practice that I have, I can hear stress through the breathing process. I can hear it. And it's usually in the form of this kind of, now that's for those of you who have kids, I've got one daughter, she's 20 now, but when she was a kid, she knew how to do that. Crying, okay? So we all know that, we've all done it. That is activating the accelerator in the nervous system, the fight or flight response. When you inhale and overemphasize inhalation, you activate the accelerator. People who are stressed are activating the accelerator, putting petrol on the fire consistently. So what do? It's very simple. You equalize the inhalation with the exhalation. When you give emphasis to the exhalation, you're putting on the brake part of the nervous system. So it's as simple as 5 seconds in and 5 seconds out. And it might seem a silly thing for me to say that people forget how to breathe, but they do. And you need to relearn how to breathe. And you need to do it when you're waiting for the kettle to boil, when you're waiting for the bus to come, all those boring moments in life, an advert in between the TV show you're watching. Breathe, 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 and emphasize inhalation and exhalation. And how do you know if it's working? So I'm nervous, my mouth is dry right now. That's why very kind people have put water here. If I create an emphasis on my exhalation, the part of the nervous system that reaches up in around here will activate my salivary glands to produce saliva. My mouth will fill with saliva. That's how I know I'm activating the brake nerves. So it's a nice little trick. If you, let's say, inhale for 5 and put more of an emphasis on the exhalation up to 10 seconds, you'll feel saliva flooding into your mouth. And that's how you know it's working. So keep it simple, but respect stress, respect the body. Don't go straight to the head. Give this thing an overlook first, and then go to the head.
Love it. That was one of the things I actually read in the book and went, I didn't know that. I didn't know that the salivary glands kicked off. So it was that sort of thing, again, the noise that's out there versus the actual science and the data that's here, which is why I was texting her every 5 minutes going, this is brilliant, I love it, I love it, I love it. And it's interesting, I do that on airplanes as well, the breathing in or breathing out for longer, and just trying to re-regulate the body system and then ignore this as best we can. I wanted to come to you, Christian. I just wanted to check. I did a schoolboy error, which is I forgot to bring a watch or a time. So if somebody can... 10 minutes, and I want to make sure we get to the audience. That's like 101. It's been a while. It's 101 what not to do. But Christian, when I was talking to Jo about you and the book, she said when she asked you to get involved that you said, Jo, I will do anything in the book as long as I get to write about kindness. And that was it. And so many of you have heard Christian speak. So I'd say that's permeated everywhere.
Oh. Thank you. Thank you. That's kind of you to notice that. And I want to echo Padraic in the sense that, part of writing this book was for us as a team to get to know each other, I think. Because the center launched and we went into COVID, I haven't seen many of my colleagues in person and it was just wonderful for us to work on a project like this. Where we got to see everybody's strengths, the creativity, the passion, the expertise, the bringing it all together. So I've really appreciated that process. And I'm also just appreciative of everybody's kindness in being here. And, all of us have spent a lot of time imagining this moment. So we're very grateful to all of you, because it's a project where the Word documents are going around, Google documents. And then just to imagine this moment really kept motivating us. So I'm grateful for your kindness, for being here today and sharing this moment with us. So thank you for that. Yeah, on the kindness, I think one of the things from a coaching perspective, which is one of the things that I brought to this, I was just thinking, in addition to the tools, the idea that there's a choice is so important. That's why there's 100+. And it's really important for the reader or the professional to choose. We're not prescribing. So this book doesn't prescribe anything. It just says, here's a lot of things. So choice is really important. And then the quality of the interaction. I think that's why I was interested in kindness. The idea of, when we're talking to people about their well-being, bringing that kindness and compassion, I think that in itself is an intervention, and it's an evidence-based intervention. There's, if you go onto the website, Random Acts of Kindness, it's an intervention that's been shown to have an impact. The beautiful thing about kindness is the person who does the kindness gets as much or maybe even more benefit than the person who receives it. And often it's free to do it. So what a wonderful thing kindness is. And then coming on to something Padraic made me think about, I was just thinking, many people in this room, I think kindness probably characterizes you, but the idea of bringing that kindness inwards. So when we are sitting on the stage and thinking unhelpful thoughts, just bring that kindness. We're good at being kind. Let's bring that to ourselves and bring that sense of compassion. So those are some of my thoughts just about how kindness can be so powerful. And, I experience it all the time in this institution. I'm thinking of Frank, for example, who shows us around. He loves this place, and you could just feel his kindness. So I just love it that this is, and what a difference that can make. And as I keep saying, it's kind of free. Final thing I'll say, a good question for us, all of us, is how do we need to be? How do we need to be so that we can be truly kind to others? What's the kind of, this idea of looking after ourselves so that we can bring true kindness into our interactions? Thank you.
Lovely. And Joe said, Shane, you love Christian. He's just so kind. What that brings up for me, I do a lot of work with people. My raison d'etre in work, when I'm working with managers and teams, is for, to work on our own mental ecosystems, our behavioral ecosystems, our mental ecosystems, because the impact that we have on those of us around you. You all work with people. You have colleagues, you have friends. If I'm not taking care of myself and if I'm toxic, the impact that has on people, which can be so detrimental for their mental health. And then if I'm their manager and I have power, then it can be a millionfold. So it's lovely to hear. And then, we'll close it up. I'd love to get questions, and I want to close it with your thoughts, because when I think about this, well, maybe we'll go get questions and then can we close it? Because I'd love to see how this book fits in with medicine going forward, how we take care of health, pre somebody having to go to a doctor nearly. And I'd love to close on that, how this fits in with that. But in the meantime, does anybody have anything they want to attack one of their former lecturers with? Be brave, you can say what you like. Do we need to get microphones or how? Then I'll pass this to whoever needs it. And I know it's really awkward asking questions when we're, everybody's up on stage. So I'm going to come down to make it easier. Does anybody have any thoughts? We have one brave soul starting. It's brilliant. Thank you.
Thank you very much. I just wanted to ask if the panel had any thoughts on how systems increasingly seem to deny humanness and things like kindness and welcoming people and things like that. So many systems just don't do that anymore.
I'm holding the mic to see who wants to take it up.
Thank you. That's a really lovely question. I think you're right. I think sometimes systems, if we mechanise the tasks of those working in the systems, we lose the humanity of the people we're working with and the worker. So that's one of the things. But the reason I grabbed the mic was because just last week I watched the launch of a strategy. The City of Manchester actually has launched a strategy for creative health. And the NHS has taken creative health on as a metaphor and a framework, and they're embedding it in their practice and in a redesign of the health service for the City of Manchester, with the hope that it will be a more compassionate and connected health service, and that will feature elements of co-design and co-creation. And I think that's something that we really need in the system. to bring our sense of connection among team members, which we got from making this book, but among the helper and the client or patient that we work with, and the impact that we have on each other as interconnected bodies in the same space. Because while we're connected with our mind and our bodies are also connected and resonate with each other. And so I think that's really important. And the last thing I'll say is the stories we tell within those systems are really important. So this is why books are very important. And we need to start changing the narrative around health and well-being and our patients that we work with. Because just recent research has shown that when we tell stories, our breathing and our heart rates synchronize in line with the story. So stories matter. And they're very important. They're not just small things. So as well as the evidence, we also need to be really good communicators of that evidence, and that needs to be told again and again in a system. That's just my... Thank you.
Is it okay to add something? That's okay? For everyone? Okay. So I just think one of our projects, our research projects, I was just thinking of that because we're finding a way to get coaching more available within health settings. And it's a challenge because the way I see coaching, the strength of it is the one-to-one human interaction. But then how do we systematize it? How do we make it available? So the idea of using coaching alongside artificial intelligence, that's what we're actually researching. Do you want to say a bit about that study?
Yeah, sure. Yeah, thanks, Christian. Yeah, no, I think it's a very important question. And I see I have some collaborators here in the technology field with us today. And, you know, a lot of bad things can be said about AI, but AI, and I think Trudy said it at the start, technology is only as good as the humans who actually develop it and input the data, right? AI is not some crazy machine who's going to take over the world. Humans input data into AI. We're the ones that can take charge. We can actually input kindness and compassion into AI. And yeah, there might be a lot of negative things with nasty algorithms that certain tech companies can use to find out where I'm doing my shopping at 12 a.m. But there are other things we can use it for as well. And we've got some great PhD scholars who are studying these concepts in how to use technology for the better. And while, yeah, there are some systems out there that have negative connotations and don't view the human, I think there's a lot of positivity there as well. So I wouldn't be heading for the bunker just yet, thinking that technology is going to get us or systems are going to get us. I think there's a lot of good people involved in tech as well who will make sure and really put things in place to make sure that technology takes those human factors into account. You know.
Hi, I've also had the pleasure of working with Jolanta and Trudy, and Joe is super positive. So I'm Darren Clark from DCU, and my question is, the wheel is absolutely a fantastic idea, and I'm just wondering, given that you wrote it so quickly in the context of COVID, how have these things potentially changed, or how has COVID changed some of these things? I'm thinking relationships, feeling good, coping. I'm wondering what maybe the research found with that.
Thank you. It's lovely to see you, Darren. Actually, the project that Darren and Trudy and I were working on was about pro-environmental behaviours and their impact on our well-being, which we don't talk enough about. And writing this book and having discussions with the team made us realize that we don't have enough research about it, hence the project with Darren, which is continuing. But a very interesting question about COVID, and We haven't actually reflected on it specifically in the book, but I think you have a very valid point that it has changed our interactions. It has changed the way it has even looking at children nowadays. And there's some very interesting research from RCSI showing that the impact that COVID has had on children is quite significant. But we are not talking about it because this research is still coming, and possibly it will take us a few years to figure it out. But indeed, the feeling good, for example, tools which are so typical of positive psychology, some of them need to be done with people. You need others to be part of it, the same as relationships, some of them meaning-making tools. So I think it has definitely impacted somewhat, but, and I'd say if we were to write it about COVID, in the COVID context, the activities might change a little bit more, but it's a great question to consider for the future, perhaps.
Thank you very much for what I thought was a very beautiful presentation. The three of us sitting here are teachers from Youth Reach, and we work with vulnerable minors, traumatized minors, and I was just interested in the immunology and hyper respiratory questions that arise when you're dealing with a young person, a vulnerable minor, and they start going down a trauma trail, and you're really concerned you don't follow them down there, which just shows you we're vulnerable as well. So I just want to know what's in the book that would be helpful to that. And just like to say also in conclusion, that's the question, but in conclusion I'd like to say thank you to Jolanta, who's actually encouraged us to start looking more at positive psychology. And our employers have responsibilities in that field, and we appreciate all the help that we get. Thank you.
Thanks very much. I'll do my best to answer that. So for me, in terms of trauma, if you'd asked me that 10 years ago, I would have, with my psychotherapy hat on, I was very head focused, very cognitive focused, very, all up here. And reading the literature and just personal experience, professional experience, life experience has really shown me that the body is the place that needs to give attention or get attention. And it's so obvious when you see people who are traumatized that they're either frozen or they're in that agitated state or they're flip-flopping back and forth and can't maintain attention. And as society, we look at people like that and we make assumptions about them. And we've all been in those stages at different points in time. But to tie it together for me, this is why, I'm not an expert in any of the different pillars of lifestyle medicine, but I love lifestyle medicine. I love the literature. For me, one of the phrases we use all the time about lifestyle medicine is a rising tide lifts all boats. So you improve sleep and you improve mental health. You improve eating. You feed the little goodies who live in here, and they'll provide neurotransmitters to make this thing happier for you up here. So if you engage in terms of basic healthy practices that are in this book, and there's nothing earth-shattering here, it's shock horror, eat a bit more vegetables and fruit, but basic simple things that we all know, there is evidence base behind it. If you try things, one of the taglines we use is, small changes for better health. That's it in a nutshell. Small changes, throw a little bit in there, cut down on the Big Macs a little bit. In terms of trauma, obviously that's a bigger thing, and I don't want to, belittle that, but it's still starting in the body, and it's those simple things, and it's the breath, and maybe have a look at how you can actually cultivate the psychobiotics that live in here by maybe eating some more sauce-based things that have onions and garlic in it, because we know that they cultivate those bugs, for example. So things that we might not necessarily think of. And then the other thing, the biggest bang for your buck, globally by far, now, and I'm a big fan of meditation, so I'll talk about meditation for hours, right? But I'm not going to say it now, is exercise. Exercise is the biggest thing. And again, we have an example in the book about doing household chores, about giving conscious exercise. So I don't want to do vacuum cleaning, right? But if you have a different perspective on vacuum cleaning as, oh, you know what, it's adding now to my 30 minutes that I have to do today, and I'll do it, and it's moderate base exercise, well, that's another thing that adds back to the body. That's another thing that takes that tiny sliver of trauma that hopefully eventually, with the support of other humans, can get me to that place where I can stand up again. So I hope that answers your question somewhat. But it's coming back to this thing first, and then coming up to this thing, you know, rather than the reverse, I think, you know.
So we're time for one more, and then she has like. She's on the line.
Firstly, to congratulate the panel on your exceptional timing for the publication of this book. I think lots of us will be recommending it on Christmases. So I just wanted to build on the point of the gentleman who asked the first question around the systems that drive us, and you know, particularly when you look at how we measure success in developed countries. It's all around GDP and all these things about consumerism, things that, frankly work against kindness. And I just wondered, particularly, probably Christy might have a view on this, about those countries like New Zealand that have, considered the happiness and the happiness budget as a way of measuring success rather than our obsession with GDP growth, etc.
Yeah, thank you. What a great question. I don't have an answer to that. But I think it's the idea of, gross national happiness, and the fact that that's becoming measured now, I think that's a positive thing. So we've got the Global Happiness Report. I'm a bit nerdy about things like this, but I spend hours on that. Just look up Global Happiness Report. You can break it down by country, by different groups. A lot of information there about what leads people to say that they're happy. So I think that's one thing. So I think more attention to that would probably be good. But again, sorry to keep bringing it back to coaching, but from a coaching point of view, I was at a conference in Birmingham yesterday. We had a lot of people from public sector organizations, including the NHS. One of the things they were talking about is the idea of maybe stepping back from goals a little bit. Maybe that we're, particularly now, think of all of us. We're just trying to make things kind of work. And, if I go to coaching and now I walk away with 2 new goals, I'm now going to start doing something else. So one of the things that I think COVID is helping us to reflect on is this idea of balance or harmony. So I love the idea that maybe we take a slightly different perspective, not only on performance, are we doing things, are we getting more things, are we making more of whatever, but how balanced are we? And so this idea of having coaching conversations which are about, just look at what's going on right now and what would be an optimal balance for you. And this idea again of it's individual. For some of us, we love novelty. I'm one of those people. If you put a scale of novelty to kind of routine, I'll be, 80 towards novelty, but not all the time. Not all the time. So this idea of thinking about what's our ideal balance, especially for people in professions like ourselves, the kind of professions we're in. We're in these professions where it's a mission. Is there a risk that we put too much into it so that we're not able to do it the way at our optimal? So this is what I love about positive psychology. It talks about optimal functioning. And I think that's such an important word for us. Optimal functioning means functioning well in a way that's sustainable over time. So I haven't answered your question, but I hope that was... Okay.
Can I just very quickly add to it? Just building on what you've said, you've actually triggered something off, and this is to do with systems as well. So what we've heard before about some of the small changes that organizations can make in order to make a big difference, like organizations such as RCSI. So I didn't mean to sit here and tell how wonderful RCSI is, first of all. Okay, so I just wanted to make sure that it's clear. But I've worked in many universities, and some of the small practices that make a difference are things like we meet every single week and we start our meeting with what went well for you. A simple activity like this makes such a huge difference to the atmosphere, to how we share information. And this is every time, without an exception. And sometimes I don't have a good day. I don't have a good week. But I sit there and think and say, yeah, this was good enough to mention at my meeting. But it at least makes us think that. Our HR department here has just created this assessment of positive organization. What does it mean to be a positive organization? I've never seen anything like it. So these are the small things that organizations can make, or systems can make, in order to help individuals feel good and give us meaning as well. It's not only about feeling happy. Sorry.
It's lovely. Thank you so much for that. And thank you all for being here. I want to close with the gentleman, Professor Ciaran O'Boyle, who brought all these people together, who created this, who very magnanimously sat back and let them share all the research and all the work that they've been doing. And for you, what is the importance of this book, the importance of it fitting in to this medical institution, to healthcare in the future, to how we take care of our people, both in work, but also just in life?
Okay, thanks, Shayla. We have about half an hour to answer that.
I'd say 4 hours, don't worry about it.
I'm aware the only thing standing between me and the people getting to that reception is this, so I'm going to be brief. A couple of things strike me. I mean, this is an incredible institution. This place has been around since 1784, and it just continues to innovate. And we punch to our weight and well above our weight internationally in terms of reputation and so on. So we have an opportunity as being a focused medical university of medicine and health sciences, of actually bringing some of this thinking into healthcare. So I see the book set in that general context. I think this book is a starting point in that it's very valuable for individuals, for health professionals, and for members of the public. The next step, I think, for us goes to the question that underpins some of the questions we heard, and that is, how do we balance out the focus on the individual and the focus on the system? Because we can talk about empowering individuals, but if they're living in poverty, for example, or they're refugees in some of these horrible centres, or there's a lack of access to healthcare or poor health literacy, empowering somebody with these kinds of tools is not really going to solve that problem. So there's a double. We have to go at two levels with this. One is, yes, we have to empower individuals, and I think the book helps a great deal in that, because everything is in there, can be backed up scientifically. But that's only part of this. We've got to scale this kind of approach through systems. And the way I see that happening is through public education. That's one, we're doing that. I think to the education system itself. Teachers are incredibly important in all of this, from primary school right up to secondary and tertiary and so on. And then I think the corporate sector and the NGOs and those kinds of systems. So part of our thinking really is how do we start then to raise the game so the systems start to make change. And Jolanta is right, small changes, leadership-driven changes in culture can change systems that can have a very profound effect on individuals' well-being, and can have the opposite, as we're seeing now. Just look at the tech sector, what's going on there. The annihilation of people's welfare, sense of being, meaning, predictability, the stressfulness of that must be just enormous for so many people. So I think what we're seeing here is a broadening of the idea of what it means to be healthy. And it goes to Abby's point about GDP doesn't tell you very much about that. GDP was a measure introduced to look at is an economic indicator of how a country is doing. It tells you very little about how people are in themselves, how well they're doing. So I think we can operate at the level of the individual, but also at the level of the organisation, and also the level of policy, national, international policy. And that's a challenge for us. And we've started walking that talk, as Jolanta is here in this organisation. This organisation has made changes to move it. It was positive before, it's becoming more positive now. We're setting up a school of population health, which is just starting to develop. Again, that's another way forward for us. We've talked about interventions with our undergraduate students, increasingly our graduate students, in terms of teaching about these different ways of thinking about health. So it's really a matter of broadening the constructs that we consider to be relevant when we talk about health in the round. And I think I better stop there because that's probably again up time.
It's wonderful and succinct. And I have to say, like as a member of the general public, thank goodness for you and all of you who have been studying this, to have a centre of excellence that actually brings it all together rather than individuals off trying to, influence in different areas. So thank you all very much. Thank you so much for creating such an incredible book. And they'll all be in the reception afterwards, so you can go and ask them every question. I'm offering you to them. But let's all get together and have good chats at the receptions. Thank you all so much for giving us your ideas.
So can I thank my colleagues, and can I thank Shana very much for doing that really, really beautifully. Now it gives me really great pleasure to welcome to the stage the president of the RCSI, Laura Vianney, to officially launch the book.
Just to say, I'm very honoured and delighted to launch this book officially. And congratulations to all the authors on creating a positive health book based on research. And I've one saying that keeps me positive, and that is, life isn't about waiting for the storm to pass. It's about learning to dance in the rain. And I say that to myself most days. So you get up and you be positive. So say that to yourself in the morning. Thank you very much.
Okay, so thank you very much. That concludes the launch of the book. We're delighted to invite you now to our reception next door. I was just struck when our president was talking about Dancing in the Rain that the iconoclastic psychiatrist R.D. Laing once said that life is a sexually transmitted disease with 100% mortality. And I think the beauty about what we're trying to do here is to operate as an antidote to that view of life. So on that happy note, let's go to reception. Thank you.